Hello everyone, I am an Asha graduate and currently working as a content producer at one of India's leading media houses. Today I am at Asha's Zakhira slum community located in West Delhi with a population of around 5,000. The people here work as rickshaw drivers and as daily wages laborer. This slum community is sandwiched between railway lines and a busy highway, and it causes a lot of noise and traffic pollution. When the second wave of COVID-19 hit Delhi in April, there was panic everywhere. Thousands of people were dying every single day. In the slums, the condition was worse. There were hundreds of COVID positive cases and people were frightened. At such a difficult time, Asha was the only NGO to continue working in the slums during the COVID peak. Asha is providing service to more than 700,000 people in the slums of Delhi. Today, I am here to follow a day with the life of our Asha warriors. I am here to walk with them and see Asha's intervention in the slums. Asha warriors consist of young people from the slum. They are a group of college and school-going students. Asha warriors have been working with great dedication right from the beginning of this pandemic. Let us have a look at the continued effort the Asha warriors are making every single day to save lives in the slums. I am now going to walk with the Asha warriors and follow what they are doing today. Here they are campaigning from lane to lane using megaphone to help spread COVID messages. They are sharing COVID protocol and explaining the importance of hand washing. They are encouraging double masking because this variant is highly infectious. As you can see, they are distributing masks to all the slum residents. Many people cannot afford to buy masks. The masks that they have are very dirty and they are not washed regularly and properly. The warriors are visiting each family and checking the temperature of each person with thermal scanner. They are also using pulse oximeter to check the oxygen levels of patients who are having difficulties in breathing. They identify patients showing flu-like symptoms, and the Asha nurses come to the home of the suspected cases to examine them. The warriors have formed trusting relationship with the people of community. That is why they are not afraid of disclosing their symptoms. They are always scared that the government might quarantine them in a government facility. They are also afraid of being shunned by other community members. As soon as suspected cases are isolated, the warriors take them for RT-PCR testing to the nearest center. Here is a warrior taking a patient with flu-like symptoms for COVID testing. I came to know from the team and warriors that all seriously sick patients with COVID are being treated in their homes by Asha. Last month, there were no hospital beds and no oxygen available. Asha team treated all the patients at home using oxygen concentrators and medicines. I was amazed to get to know that only one serious patient died. Rest have all been saved. Here, I am at home of COVID patient who is being monitored by the warriors many times a day. They take their blood pressure, check oxygen levels, pulse rate, temperature and blood sugar levels. Because the warriors are checking the patient many times in a day, the patients are getting better. This is a warrior taking some residents to the nearby vaccination center to get vaccinated. They are motivating the people because many of them are scared to take the vaccine. If the warriors don't take them, hardly anyone will go on their own. Now, I am at Asha Community Health Center in Zakhira. Shiny, who is a nurse and the team leader, is giving vitamin D3 injections to the adults. She explained to me that the vitamin D3 levels are low in all the people living here. Giving these injections will increase the immunity levels of the population. The people are telling me that they are very happy with these injections. Here we can see the feeding program of Asha for malnourished children and women. They come here to eat the Asha Laddu daily. They do not get a proper diet at home and they have lost a lot of weight during the pandemic. Because of the pandemic, most people have no work. They are on daily wages and nowadays they don't have money to buy nutritious food and make proper meals. Here I can see that the Asha team and warriors are giving groceries parcel to each and every family. Asha is standing with them during this crisis and during such a difficult time. Here is the Asha IT center with high speed internet. Here the students are able to do their school work and university work. The impact on education has been severe with young children forgetting their basic education. Most of the slum families cannot afford to provide online education facilities for their children. If Asha was not here, the students may have dropped out from school and college. Here you can see the warriors providing free coaching to the students in various subjects. Asha intervention would have not been possible without the Asha warriors. They are brave and hardworking and they are role models for the people in their slum communities. Asha continue to provide the warriors with safety gears and medical equipment that will help them with their daily work. I appeal to you to be generous with your contribution and support the work of Asha. Hundreds of such slums still need your help to survive during this pandemic. There is still a long way to go and a lot need to be done to help as many people as possible. Please help the Asha warriors to save lives.